biggest question I would have with her and her activity is she can't bike anymore, she can't run anymore, but when I hike her, what's the right amount of activity?
You know, if her joints aren't feeling great because she's older, really what joints need are good, strong muscles. So in order for her to get those strong muscles, she needs to move. She needs to be active. And I think that taking a nice, slow walk like this is perfect for her. And tomorrow, you see how she is. Is she sore the next day? Does she look uncomfortable the next day? If the answers to those questions are yes, well then she got too much. I would take it down by like 50% and then go ahead and do the same activity.
Are there ways to warm her up, cool her down to help maybe prevent some of this damage or
Absolutely,
limping?
Absolutely. And I think the two main ways I would do it at first is just passive range of motion exercises and a little massage. This is perfect as a warm-up. Gently stroking her lower back and massaging her, sometimes using your thumb in a circular motion here, and then just extending and
really working
flexing.
On those
yeah,
hips.
really flexing and extending her hips. This is her knee I'm working. If we want to extend her hip, we just take it back, but not to a point at which she's uncomfortable. Those types of exercises are fantastic for her, especially your joints. During a warm-up or even a cool down, she's gonna feel much less sore the next day.
All right, that's good to know. Yeah. She's enjoying her walk today without us.
Right,
She's like, I'm gonna go sniff some of this interesting grass here.
I think we're going a little too slow for her.
Let's go.
All right.
Courtney, I have a question, and Travis and his dog kind of speak to this, but talk a little bit about how dangerous it is for people to give human medications to animals.
I think a really clear message is this. Your dog and your cat's liver is not the same as yours, okay? A dog is not a little human, a cat is not a little human. So they're not gonna metabolize those drugs, those medications the same way you or I would. I mean, I think the most classic example of this is acetaminophen or Tylenol in cats. I mean, that is toxic. But same thing in dogs too. Certain dosages of ibuprofen, aspirin can be really problematic. And so I think that's an absolutely important point. When you think, well, let me just give them a couple aspirin. Jump on the phone, call your vet. Is that okay?
And I have to say, Dr. Courtney answered a ton of other questions during Nala's house call.
Fun, yeah.
We're going to put more of that interview on our website, thedoctorstv.com. He's got tips for the healthiest snacks for your dog, how to comfort your pup when you're away, even some tips dealing with doggy hearing loss. It's really great information. Courtney, thank you so much.
Oh, my goodness.
Awesome.
Thank you.
Hey, and Nala, if you're watching, Daddy loves you.